Good afternoon. A very warm welcome to you on Parentune Live. I hope you and your family are doing well. My name is Jharna Kukreja and I'm your host for today. We're joined by Parentune expert Dr. Manoj Yadav to know why your baby spits up milk, the causes of reflux, and how to deal with it all. Welcome, Dr. Manoj. Dr. Manoj, if we could start off by telling us, why do babies spit up milk? And is it normal for that to happen?
Hi, good afternoon, everyone. So we will first deal in a chronological manner. First, we will see for the neonates how it happens with them. So generally in neonatal age group and in infancy, less than 1 year of age, we see this problem. Almost every parent is facing this problem. So I'll tell you that a reflex generally happens in most of the kids. Some may be spitting out milk, some may not be, but it generally happens in most of the kids. It starts at 2 3 months and peaks at 4 5 months, and then goes on for sometimes up to 1 year, or even up to 2 years of age.
I see.
So this
Doctor, can you hear me?
yes.
I believe we're having a video issue with Dr. Manoj Yadav. He'll join us back in a second. So our topic today on Parentune Live is we're talking about baby spit up. And if you have any queries related to baby spit up or reflux and how to deal with it when it comes to your baby, you can post your comments and questions in the comments section, and we will have them answered in just a short while. We are joined by Dr. Manoj Yadav today, who is a Gurgaon-based pediatrician, and we're talking about the issue of baby reflux, which is commonly seen in almost every baby. Where after you fed your baby, whether it's bottle feeding or breastfeeding, there are issues of the baby spitting up some amount of milk back up. So we'll be discussing whether it is normal for that to occur, or whether when it could be a cause of concern, when you need to seek medical intervention, and what you can do as a parent to help out with these issues of reflux and baby spit up.
Hi, good
If you
afternoon.
just joined us now, we are on Parentune Live. We're talking about the issue of baby spit up with Dr. Manoj Yadav. Doctor, can you hear me?
Yes.
Doctor, till we get your video back, why don't you just start off by telling us why do babies spit up milk, and is it normal for that to happen?
So as we were discussing, see, it is seen in mostly in the neonates and infancy. So up to 1 year of age, that the child spit up milk. So it usually happens by 2 3 months and peaks at around 4 months. And later on, as the child progresses in life, the spitting out of milk and reflux just decreases. In almost 80-90% of the patients and kids, it usually goes by 1 year, and maximum they're fine by 2 years of age.
Right. And how common is it for babies to experience, to deal with this or experience this issue of spit up?
So most of the parents and babies are experiencing this thing. So I would like to tell you that in case your child is spitting out milk, then we need to look into few things in order to tell whether it's normal, abnormal, or if it's going somewhere else. We need to look into another conditions, few conditions, surgical conditions and other things before telling whether it's normal or not. But as a layman, I can tell you that for a general public to understand this, I can tell you, if your child is gaining weight well, then most of the things are not to be looked into. If the child is gaining weight well, then we are not much concerned about that. So we must tell every parent to look into the weight gain. Every time they go to a doctor, they should get the weight checked with the visit they are doing for vaccination and all that. If the weight gain is good, most of the things I think are fine. But still, if we are looking into reflux part, some of the baby might be spitting out milk at least 1 to 2 times or even more. I think we will discuss as the session progresses that how to deal with this, and we can be, telling how to, see if the child is fine, or we can how we can conservatively manage all these things.
Thank you so much, Dr. Manoj. We'll try to get your video back. If you've just joined this Parentune Live, we are discussing how to deal with baby reflux, baby spit up, what are the causes behind it, and how you as a parent can help your baby deal with this issue. Whether you're a breastfeeding mom, a bottle feeding parent, dealing with baby reflux, it can be startling and nerve wracking as you try and figure out whether there's something wrong with your baby, how you can help them, and then and if something is wrong with them. We're going to discuss how you can help them and whether or not they have taken in enough milk and what you can do about that. We are joined by Dr. Manoj Yadav, who is a pediatrician based out of Gurgaon with almost 10 years of experience. And he will be answering all your queries. So if you have any questions related to baby spit up or reflux, do make it a point to post them in the comments section and we will have them answered in just a short while. We are going to go back to Dr. Manoj Yadav. He's joining us from Gurgaon. We're experiencing an issue with his video, but we're going to go ahead and ask him a few questions. Dr. Manoj Yadav, if you could take us through some of the causes behind baby spit up. Why does it occur in babies?
So we will look into the causes why it happens. So initially in neonatal age group, as we start feeding the kid, first I'd like to tell you that when we start feeding the kid, initially there is problem with latching and all these things. So there is engulfment of air which goes into the baby's stomach, and this can cause some reflux. Also physiologically, some amount of reflux is always there, and there is reflux which is because of the decreased tone in the lower esophageal part. We can tell you that simply the lower part of the food pipe, the tone is usually low in kids. So as the stomach, the child gets milk, the stomach sometimes spits out the milk. But it can happen if there is a lot of engulfment of air, especially in those kids who are on bottle fed. So along with the breastfed also, bottle fed kids are facing this problem many more in severity also, and many a times a day, rather than those on breastfeeding. Although breastfeed kids are also facing this problem, but usually they are in lesser number than those bottle fed kids.
Right, Dr. Manoj. There you heard it from Dr. Manoj, who's a pediatrician, who says that baby spit up is an issue with both bottle fed and breastfed infants and babies. And a lot of the causes are related to physiology. Dr. Manoj, if you could tell us, is overeating by the baby ever a cause for reflux or a baby spit up?
Hi. So overeating, we cannot say in in neonate and infancy, because we are the one who are feeding the baby. But usually in older children, this can be an issue. But in kids and in neonatal age group also, sometimes the baby feeds during feeding takes more of milk instead of that much required, because the baby can that can cause regurgitation itself. But that is not an issue, because that amount of milk which is spit out does not cause any harm. We usually call those baby happy spitters, because these baby spit out the extra amount of milk which they have taken in, and along with that air which they have engulfed. So we tell every parent to do burping. That burping helps, because that burping part will lead to release of those gases, and also it helps because it helps in relieving the colicky pain that parents come across during this neonatal and infancy age group.
Right, Dr. Manoj. Dr. Manoj, is any sensitivity ever the cause of baby spit up or reflux, or any particular food allergies? If the mother is consuming, if the mother is breastfeeding and is consuming any kind of food, could that be the cause of baby spit up? Or once the baby starts solid foods, any solid food intake, could that be the cause of spit up in infants?
Yeah, we have seen that, but normally, as we say, as I have said earlier also, that most of the kids, if they are gaining good weight, we don't have any problem with the things. But sometimes, if there is reflux is continuing, and even after trying some medication and conservative treatment, it's not going, then we look into other things like, surgical causes and food allergies. Food allergies like milk protein allergies, cow milk protein allergies, soya milk allergies, and all these things may be the cause of reflux. But mostly in those cases, the child won't be gaining good weight. Even if some amount of allergy, mild forms are there, which could be causes some amount of diarrhea, reflux, constipation, and all those things. Still, the weight gain issue and all these things are there. Sometimes we call this terminology as failure to thrive, that the child is taking a good amount of milk and also nutritious diet, but still they're not getting good weight gain. So in those cases, it's depends upon the index of suspicion we are showing while we are checking the babies. But still, if the weight gain is good and other things are normal, do not worry at all. Do not go into those things as a parent, that your child might be having that allergies and all these things. Instead, you focus most on the feeding part. And even if you are concerned about the reflux part, you can visit a doctor. You can discuss with him that how much time the reflux is happening. I'll tell you a few more things as we go on with the session, that how much time reflux can be normal, or what are the danger signs as we see in babies who are facing these problems of reflux and spitting out milk.
Right, Dr. Yadav. Dr. Manoj, we'll now move on to some of the questions that are coming in from parents. Our first question is from Harshita Aswat, who has a 1 month old newborn baby. And Harshita says, my baby has vomited thrice from the last 2 days, and she vomits the complete milk which I fed her. Is this normal, and what should I do?
Hi, Harshita. So, as I have said, 1 to 2 times a day is generally taken as normal, because some babies can spit out this much amount of milk. They might be taking large amount, or sometimes they might be engulfing more amount of air. I'll tell you, best way to deal with this is that initially, because these things are faced for first time parents, or also and also who are in infant neonatal age group less than 1 month, because initially there is problem with the latching part. So I advise all those parents who are having this issue that you stick to the breastfeeding part as advised. In case you are facing any problem while latching your baby, then it's better that you take a consultation with a doctor or a lactation consultant, that how to latch your baby properly. I'll tell you what can be the reason, because when the child starts feeding initially, he might be you making some sounds. If the child is making a lot of sounds while feeding, then it can be that he is not properly latched. You can see few videos also, the technique of proper latching the baby to the breast, and then you can see these things. Also, continue burping. Some parents might be saying that if when they are burping, the child does not burp, but it does not mean that you stop this thing. It's beneficial in both ways, in regurgitation part also, and in other things like colicky pains also. So you continue with that. And as I advise you, as the child goes on for vaccination at 1.5 and 2 years 2 months of age, then you weigh the child. If the child is gaining good weight, 1 to 2 times splitting of milk is taken as normal.
Right, Dr. Manoj. Doctor, you mentioned that in your advice to Harshita, some guidelines related to feeding her baby. Could you tell us a little bit more about what guidelines a breastfeeding mother should follow to avoid or to help her baby deal with spit up?
Hi. So first I'll tell you right from the beginning that we advise everyone to breastfeed right from half an hour to 1 hour after birth. So that is early breastfeeding. As we start initiation of the breastfeed should start half an hour to 1 hour later of delivery. So sometimes we as a parent start doing that. If the child, we are not getting enough milk, and we start feeding the child with formula milk and other things. Sometimes even we have seen parents giving honey and water and all those things initially. So I advise in initial few days do not do all these things. You just have to stick to the basics and give breastfeeding. Initial 1 to 2 or 3 days, up to 3 days, the milk production is a bit on lower side, but as the child starts feeding, the milk production increases. So an initial part of the milk is very important, as it's called colostrum. It's very important for gaining antibodies and preventing fighting infections from baby's point of view. So also I would advise that when the child is delivered, in case you're feeding that you're facing the issue of breastfeeding, wherever you are, like you are in a government setup or you're in a private setup or nursing homes, I will tell you that you ask your pediatrician or your doctor or your gynecologist that please advise me how to feed my baby. It might look very simple, but sometimes it's a very complicated thing for the early ones, for the first time parents, that the child, as the child starts feeding, you might not be able to properly sit. I'd advise every female to properly sit first, hold your baby in a proper position. We usually call 2 3 positions as cradle position, football position, and all those things, crisscross. So I'll advise that every parent should learn all these things. Latching part has few things like the areola, the up should be covered fully. The chin should touch the breast part, and the child should be, the spine, the head, and the hip should be in a proper line. So we can share a few videos also from parentune, and also few pictures of these things, that how the positioning should be. But in case you are facing difficulty, do not try to avoid this thing. Just go to a doctor and learn all these techniques.
Thank you, Dr. Manoj, for all those guidelines for breastfeeding mothers on the correct technique, the correct position, and tips for them to avoid or baby spit up or help their baby deal with spit up. Doctor, moving on to formula fed babies. Our next question, in fact, comes in from a mother of two twin babies who are 2 months old, and they are currently being formula fed. Our next question is from Ritu. Ritu says, "Hello, doctor. I am a mother of twin babies. They are 2 months old and they are formula fed and they spit milk frequently. Please help with this." So, doctor, do you have any advice for parents of formula fed babies on how to deal with a baby spit up?
So as you are having twin babies, so I would like to tell you and dispel this myth that you need to feed the twin babies with formula. Sometimes you might feel that, and most of the parents feel like that. Yeah, and even many people say that this when twin babies are there, then your breast milk is not sufficient for both the babies. So please, try to avoid all such statements, even if you're telling others about these, that this twin baby may not be, you are not getting enough milk, or you're not giving enough milk to a baby. Twin babies can be fed normally as a single baby only. So every time you feed your baby, just make sure they're latching properly. Just make sure that you are also taking good amount of adequate diet, good nutritious diet before breastfeeding, so that you are not deprived of any nutritious thing. Now if you have a twin baby and you have started formula feed, I'll advise, in case you have just started all these things, that you shift to exclusive breastfeed. Exclusive breastfeed is like you don't have to give anything from outside. Now still, if you're formula feeding, you might be facing few problems of regurgitation and all these things. But regurgitation specifically is seen in formula fed babies because we might be dealing with a if the formula is not being prepared properly, if you are giving extra diluted or extra dense milk, then this is a problem we face. And sometimes the formula may not be, the child may not be taking it because of the taste, or because of the child is getting confused in breast milk and also formula milk. We call it nipple confusion, and they may totally then shift to formula milk. They will totally stop taking breast milk. So in order to avoid all these things, you should try and stop this formula milk. And especially if you're giving by bottle feed, then this causes a lot of air engulfment by the baby, because bottle while taking feed from the bottle, there is a lot of air engulfment because there is no proper latching, and the child is just sucking. Even if the child is not sucking, there is some trickling of milk from the bottle directly into the child's throat, and he might be just be drinking milk. So I like to advise you that you check in all these things, that you're preparing formula milk properly, and also sterilizing the bottles properly. And even if you are doing all these things properly, just purp the baby and try and avoid formula milk as much as you can. And even if you are facing this regurgitation part, just check for the weight gain. If the weight gain is proper, do not worry, continue with the things. And if still you are thinking that the child is spitting out a lot of milk, and child is having other issues like excessive irritability. Now we come to the second point, as I advised earlier, that if the child is excessively irritable, crying a lot, cranky, and not gaining weight, all these things might be because of reflux. Now, if this is happening, we need to look into matter, even if the child is gaining good weight, because excessive irritability and all these things might be because of the reflux part. So in case you are facing this problem, then we need to go to a doctor, check whether the child is having these issue actually, and if the child is excessively irritable or not able to sleep for a good amount of time, or not gaining weight, then we can go for some changes, and sometimes even if some medication is required for a week or month sometimes, in order to correct these things.
Right, Dr. Manoj. Thank you for all your tips for Ritu, who has two twin babies. And Doctor, I'm going to second your advice to Ritu on the aspect of breastfeeding twins. I'm a twin mother myself, and I nurse them, so I know it's definitely possible, though difficult, but possible. Ritu, if you could take on the doctor's advice and give breastfeeding a go. And if you are formula feeding them, then Dr. Manoj has given you some tips to help you deal with baby reflux. Our next question, doctor, comes in from Neetu, who has an 8-month-old baby. And Neetu says, hello, doctor. My baby is 8 months old. She does not feed anything. She throws everything from her mouth. And her weight is also not increasing from the last 6 months. Please suggest how to feed her. She doesn't take anything. So doctor, is spit up and, spitting out feed on food also an issue post 6 months when babies have started solids?
So, Neetu, as a child is 8 months old, and you must have started with the complementary feeding part, and you might be, giving everything, trying everything. But initially, it can happen the child does not take uh, food. They just take in the mouth and spit out. That's a different issue altogether from the reflux part. Reflux part is like when the child takes in the food items and it goes into the stomach and then it comes back. So that part is called reflux, and this is just you can call it fussy eater, or the child is not taking the diet properly. In your case, he is properly he your child is not properly taking the things. So I'd advise you that you might be trying a lot of things. So I'll tell you that start with one or two things at a time. If suppose you are giving, suppose you make up a mind that you will give dalia today. So now if you try giving dalia to your kid and he just does not take, or take 1 to 2 spoons and just spits it out and goes playing, now what next? So you must be thinking that the child is not taking dalia. So I think you should do one thing. You try and give him next day and few more days, like try and give it to for one more week. If the child then does not take it, then we can say the child is not accepting this dalia and all. But stop for 1 to 2 weeks, then try it again. In the meantime, you can shift to another thing, like suppose now dalia, after that you can give some puree or something like that. When you do this thing, then after some time the child develops a
Yes,
taste
doctor, go
and he
on.
starts accepting. The child develops a taste and he starts accepting all those things. So it takes some time. Also, I'd advise you that you because sometimes initially the child may not be taking adequate amount of diet, so you try and give more of calorie dense food. Calorie dense signifies that you give more of dense food instead of giving watery and semi solids or more like that, so that it will at least if you are giving half katori or something like that, it will give good amount of calorie to the child, even if the child is not taking adequate amount as in a whole day. So this will probably help. And try and make eating a fun. Sometimes just give them something to eat, so that it they just take it as finger foods and all those things. Just roaming around, they are just taking this, and this will help a lot in gaining weight also, and making them understand the uh, art of eating.
Thank you, Dr. Manoj. Our next question comes in from Sabah, who is the mother of a 6-month-old baby. And Sabah says, what can I feed my 6-month-old baby? I'm quite worried to give her semi solid food compared to liquid. Because just 2 months ago, she had a stomach surgery because there were loops in her intestines. Please advise.
Hi Sabha. So as you said, the child had some loops in the intestine, and I think that part is corrected now. So you need not worry at all for that part. So that loop part was, I think surgically corrected, or rotated or something like that. Torsion was there or whatever. So that part was corrected. Now the child is, behaving as normal child as it was earlier. Now the child is 6 months old. So you start giving him complementary diet. Do not worry at all for semi-solid part, because since your child was surgically managed, so the weight gain now is a very good, is a major issue, because you need to correct for that part also, which the child might not have gained weight because of your surgical issue, or because of the surgery part, which that part is lost. Now you need to give more of the diet so that your child gains a good amount of weight and is at par with the other children of the same age group. So you give more of calorie dense diet rather than thinking of not giving it. Liquid diet will help, but still it will not help much in weight gain. So you try a few things like banana, mashed potato, and make purees, all those things. Try and make more calorie dense diet. Also, the consistency of complementary diet should be like, if it should neither be too liquid or not too solid. It should just be, the child should just be able to take it, and should not excessive water in the diet of these age groups. 6 to 8 months of age group won't help in much weight gain. So do not worry about the surgical part. Just take your child as normally as the other kids, and just try and feed the complementary part, as we have advised in many videos also we have shown, and we advise daily that how complementary part should be given.
Thank you, Dr. Manoj. Doctor, our next question comes in from Abhilasha, who has a 3-month-old baby. Abhilasha has said, my daughter is 3 months old and she gets uncomfortable when I put her on the bed. She gets reflux. How can I help her? So, is there anything she can do with respect to the baby's position?
So, Abhilasha's baby is how
Three
many
months
months?
old. Three
three
months
months
old.
old. So Abhilasha, I will tell you one more thing about the positioning and reflux. So we usually have, as scientifically we have seen that babies who are nursed in prone position have less amount of reflux than who are nursed in supine position. But prone position has its own complication, and few, sudden infant death syndromes have been seen. So we usually do not advise to nurse in prone position, but we usually advise a tummy time. The tummy time is basically after you feed your baby, you just nurse him for 5 to 10 minutes in a prone position, right? The prone position is like, the child lays down on his stomach on the bed, and you just pat him for some time, so that the child lays in for there for some time. This prone position especially helps in both the things, and co-liquid part also. So that the reflux part might, you might be able to help in that reflux part. But since you are saying that your child is 3 months old, This reflux part is usually at peak from 3 to 4 months. So do not worry, you might child may just be having more of reflux in this month, but it will go away after 3 to 4 months. So do not worry.
If you've just joined this Parentune Live, we are discussing the causes of baby reflux. Why does your baby spit up, and how to deal with all that? We are joined by Dr. Manoj Yadav, who is a Gurgaon based pediatrician. He's answering all your queries on how to deal with baby reflux. If you have any questions for Dr. Manoj, you can post them in the comments section, and we will have all your queries answered in just a short while. Uh, Dr. Manoj, can you hear me? We'll be joined by Dr. Manoj in just a short while. Like I was saying, we're discussing about the causes of baby reflux, which is a common problem in babies, where they have the tendency to spit up some of their feed, whether they're bottle-fed babies or breastfed babies. The issue of reflux and spit up is very common in most babies. We are answering all your queries on that. I'd also like to remind you that you can ask your queries to Parentune experts 24/7 on the Parentune app or on our social handles. Also, remember to subscribe to Parentune's social handles for updates on our interesting lives and workshops. Um, we are joined now by Dr. Manoj Yadav, who is answering all your queries on baby reflux. Doctor, you were telling us.
So I was able to complete that part or not?
Yeah, Doctor, you can repeat your answer for the previous question. Dr. Manoj, can you hear me?
Okay,
You
so
can.
I was telling you about.
Yes, you were addressing Abhilasha's question, who had a 3-month-old baby, and who's facing issues of reflux when her baby is kept down on the bed.
So I was telling you on natural ways to deal with the baby's reflux. So
Yeah.
it was like I was telling you that the babies can be nursed in prone position for some time, especially after feeding part. That you lay the child prone. Prone is basically when you lay the child on the stomach. So when you lay the child on stomach for 5 to 10 minutes just after feeding or after burping, that will help in both the things like reflux and also in colicky part. So this is very important for those who are facing this reflux problem. But as you said, your child is just 3 months old and he might be having that peak time of reflux 3 to 4 months. So do not worry, just weigh the child. If the child is gaining good weight, do not worry at all. 1 to 2 times, sometimes even more, can be taken as normal if the child is gaining good weight and if the child is not showing any excessive irritability or something. One or few more things I would like to tell you, that few things you can just see yourself in order to tell whether the child is having reflux, is like if the child is excessively arching backwards, or the child is keeping his neck like this backwards every time, then this few are the subtle signs of reflux. So in case you are having this, you can just consult your doctor and see if the child is having this. Another thing is excessive sometimes some parents are giving multivitamin drops and all these things. Please do not fall into this. Only few things are recommended up to 1 year of age in good health, good weight babies, that is vitamin D drops, which are usually given up to 1 year of age. Otherwise most of the multivitamins are not needed. Sometimes you might be giving those, and these itself might be causing excessive gastritis in small kids and even in older children. So especially we are talking of small kids only. So I think that would help you, Sabha.
Right, doctor. I hope that answers your question, Abhilasha. Uh, Dr. Manoj spoke about how multivitamins can sometimes cause reflux in babies. Doctor, our next question comes in from Anila M, who has a 1-month-old baby. Her baby is actually 1 month and 15 days old. And she says, "Hello, doctor. My son is 1.5 months old. 2 days back, he got his 6 weeks vaccination done. And after that, he spitted out milk and he also vomited twice. And some amount of milk even came out from his nose. He's a breastfed baby. So, what should Anila do? She's asked for suggestions from you, doctor.
Hi Anila. So as you said, your child got vaccinated 1.5 months. So in these cases, the child might be in pain because of the vaccination itself. That can cause sometimes local swelling and pain. So because of that, there could be excessive irritability or crying. Excessive crying and irritability itself causes increased abdominal pressure because of those muscle. So it can cause spitting out of milk for this time, 1 or 2 days. So do not worry about that. Even if the child spits out milk from mouth or nose, it's one and the same thing because the nasopharyngeal cavity is almost the same. So the spitting out milk is a concern. Otherwise, do not worry. Just give simple paracetamol drops for 2 days as the child has been vaccinated. That will decrease the pain part also, and this will help in this just the acute part of the reflux.
Thank you, Dr. Manoj. Doctor, our next question comes from Shauki John, who has a 7-month-old baby. And Shauki says, "Hello, doctor. My baby has entered the 7th month, and whenever I fed him with semi solid food, after some time he spits out the food, but he doesn't spit it out immediately. I want to know the reason behind that."
So, as he said, that he's spitting out milk after some time. So these are probably the feature of reflux. So I will tell you, if the child is you are giving adequate amount of diet, I would advise you, as I said in earlier cases also, that give more of calorie dense diet. Do not give too much of water and liquid diets, because too much of water and liquid diet can cause these things. Sometimes the calorie dense diet given at frequent intervals will help in preventing this reflux part. For some initial time, if the child is also complaining of pain abdomen along with this, so you can give few medications like anti PPI, we call them proton pump inhibitors or antacids. This can help for acute part like pain abdomen along with the reflux, but try and give more of calorie dense diet, give for frequent intervals, and also advise child not, if you are nursing the child yourself, do not allow the child just to lay down just after giving something, or do not allow the child to drink a lot of water just after eating, so that it will help in preventing excessive distension of the abdomen. This will help in preventing the reflux part. Also, if the child is irritable because of that, or you're facing weight gain issue with that, you can give some prokinetic drugs which we are using for increasing the lower esophageal sphincter tone. But I think these are last resort to the this reflux part. I will also advise you to give wholesome diet, some fruits, some vegetables, and all those things, instead of giving more of fast food and all this. This is special advice for toddlers and the older children who are craving for junk foods and carbonated drinks. I'll advise you to not give too much of carbonated drinks, also chocolates, carbonated drinks. These itself can cause a reflux because of gastritis and all other things. Carbonated itself can lead to gastritis.
Right, Dr. Manoj. Doctor, our next question comes in from Lee, who has a 3-month-old baby. Lee says, "Hello, doctor. My baby is completely breastfed. She started spitting out milk when she was 2 weeks old and is currently 3 months old. Doctor, it's said that her baby's pediatrician has told her it's silent reflux and put her on some medicine. She still spits up milk despite being on medications. So, doctor, do you have any advice for Lee, who is a three month
Highly.
old? Yeah.
So Lee, as I told you that the child might be, at its peak of reflux at around 3 to 4 months. So do not worry. If the child, your pediatrician advise some medication, they might help, but they are not, 100%, because the cause of reflux, and if the child is, one of the happy spitters, as I told you that he or she is, spitting out milk 1 or 2 times, or sometimes 3 to 4 times, but the child as such is happy, he or she is taking, good breastfeeding, as your child is breastfed, so he or she is, breastfeeding properly, is not, like avulsing from breastfeeding or feeding, then I don't think it's an issue. Just give the medication for as much your the pediatrician has advised for, 5 days, 7 days, or sometimes even longer. So this will help. Also try and do the nursing part, as I told you, the tummy time. This will help in preventing this reflux part. And I think after 3 4 months it will, start decreasing. And as the child goes up to, 6 months and we start complementary feeding, this further decreases. And otherwise, if you feel like, there is distension abdomen along with reflux part, or there is, excessive irritability, then you can consult your doctor, review with your doctor again in case you're having that issue. Otherwise, do not worry at all.
Right, Dr. Manoj. Our next question comes in from AV, and who says, "Why do babies spit up milk and sometimes curd-like milk? Can you please share what is the difference between milk that is normal and what is curdle type of milk that the babies often spit
So
out?"
maybe I'll tell you the difference. See, when the child takes milk, so the milk, suppose the child just took breastfeeding and spitted out the milk right away. So that milk is probably the same milk as it went. Now, if the child, spits out milk after, 15, 20, or sometimes 30, 40 minutes, that part is curdled usually, because the stomach has acid, and the milk which the child has taken, that, is digested, sort of semi digested. Now that part, if it comes out, is curdled milk. Otherwise, the milk that directly comes out is the same, is undigested milk. So do not worry about that part. The curdle part or the direct milk that has spit out may be a concern in few cases, like, we call those conditions surgical conditions, like pyloric stenosis. In that case, the child will almost every time spit out the milk just after feeding, and there could be, abdominal distension along with that. And also there is usually not good amount of weight gain. It is usually seen at 1.5 to 2.5 months of age, but after that, especially in this age group, and it could be, severe condition, but that is surgically corrected in case that is happening, and is simply diagnosed with the ultrasound abdomen. But do not worry, if in case you're as a parent feel like your child is having some issues, you can go to a doctor. In case your doctor advises to go for some investigation, then go for investigation. And if something comes out of it, if it's a surgical thing, we can get it correctly easily. Otherwise, just look for the weight gain, one of the best parameters to, negate all those things.
Right, Dr. Manoj. Doctor, you mentioned how in some cases there are reasons responsible for baby spit up, which may require medication, which may require surgical intervention. So, when, as a parent, when should you visit your baby's doctor for issues of reflux or baby spit up? At what frequency?
So I'll, jot down the points for you, that in case you're feeling you should go to a doctor, I think first and the foremost thing is, if the child is not gaining weight. This you will look over a period of time, instead of just, looking for one after 1 to 2 days, because the weight gain is quite less in, 30 40 grams per day. And over the period of time, it's not adequate weight gain, then you go for a visit to a doctor. Second thing is, if the child is excessively irritable and cranky. Third thing is, if the child is excessively arching his back, or, the neck back, then it could be a sign of reflux. Third thing, if the child is excessively spitting out milk. Along with that, if you see this is for not just for neonatal or infancy, even for older age group. Along with the milk, if there is, excessive greenish vomiting, or there is, excessive vomiting along with the spitting out of milk, even if after, the child is not taking any feed properly, still the child is vomiting out, it could be sign of obstruction. So in those cases, you need to go to a doctor. Along with this, if the child is having abdominal distension, or if the child is having other neurological issues, you might be knowing if the child is having neurological issue. Or if the child is already facing some neurological issue, then most of the kids might be suffering from GERD, like gastroesophageal reflux diseases, because neurologically intact children are usually capable of handling all those things, but those neurologically impaired might be having these issues. So in this case, if you are having this 5 6 condition, you should certainly go to a doctor and ask if it's normal or abnormal. Another thing I left is the allergy part. In case the child is having rash over any body after feeding, or the child is having excessively gastric or other issues, then also you consult for any allergic. Or if the child from your family suffered from such things earlier, or you might have suffered from such things, then you need to go to a doctor.
Thank you, Dr. Manoj. There you have it from Dr. Manoj, who is a pediatrician, on the circumstances wherein you should look for professional help to deal with your baby's spit up when the causes could be more complicated, and your baby might require medication or surgical intervention. Doctor, a concern as a parent when your baby is facing spit up issues is often whether your baby is taking in enough milk. So, how, as a parent, how, as a mother, would you know if your baby is taking enough milk if your baby is also spitting up?
So, yeah, the best way to deal with this issue is like, first, I'll tell you in the neonatal age group for the first time parents, the best way to know qualitatively, I can tell you first that if the child is taking feed at least 8 to 10 times on demand, the child is passing urine 6 times or more in a day. If the child is passing urine, then the child is passing stool. It could be sometimes 5 to 6 times or even more in a day, or sometimes just 1 or 2 times a day, or even in 3 to 4 days on breast milk. Then I think most of the cases might be normal. The quantitative part is that we weigh the child, we check for the weight gain. Initially, in first few days, the child might not get that amount of weight which is required, because initially there may be loss of weight, but that is not to be taken into account. Just weigh the child when you go to a doctor for a visit, and if the child is gaining weight, good weight gain, then I think you need not worry about that. Also, if the child is sleeping comfortably after taking feed for around 1.5 hours to 2 hours for neonatal age group, and the child is next time when the child wakes up, takes up the feed comfortably, then there is no issue. Also, if the child, even if the child spits out milk, but he's playful and taking feeds normally in the next time you are feeding, I think that's very good.
Right, Dr. Manoj. Dr. Manoj, our next question comes in from Raj, who has a 4-month-old baby. Raj says, my baby is 4 months old and is completely breastfed. Even despite that, he keeps vomiting milk, and sometimes it's in the Kurdish form. But he spits like anything. Since day one, he has been spitting up milk. So, any advice for Raj?
So, Raj, as we have told in the session that the spitting of milk is sometimes taken normal, but if there is excessive spitting of milk and the child is not gaining weight, you should go to a doctor. Also, as I advised, you can use this prone position and tummy time in order to relieve for some time. It could help you. The third thing, in case still you have done all these things and the child is still spit out, when the child might require medication for some time, especially for the reflux part, and if the child is excessively irritable. The third thing, we need to look into some other condition. If the child is facing like any abdominal distension, or neurologically the child is sound and all those things, if all those things are normal, then sometimes few medication for few weeks would help, and they will probably help in relieving the reflux part. As the child grows, the child will outweigh all those things.
Right, Dr. Manoj. Doctor, our next question comes in from Uzma, who has a 5-month-old baby. Uzma says, my baby is 5 months old and spits up milk after every feed. He's on formula milk and he takes 2.5 ounces of milk after every 2 or 3 hours. Is that quantity appropriate for Uzma's baby, doctor? And what could be the reason her baby spits up milk after every feed?
Hi, Uzma. So this is good point you have told me. I think this part is also important. The amount which we are feeding by formula. So while we are formula feeding, so sometimes it happens that we just prepare a formula and give the bottle, so the child takes up good amount of milk, and sometimes that part, if the child has taken more amount, that the child might spit out the excessive part. But you make sure that in case that as a child grows, you might be able to know how much the child is able to take. So instead of just giving him bottle every time without knowing how much the child has taken and how much the child has left, it becomes difficult to know whether how much the child will take the next time. So, Uzma, as a mother, if you know how much the child is leaving every time, and suppose the child took 80 ml, and the next time you are giving the child took just 60 ml, the next time again 60 ml, so he is probably taking 60, 70 ml that day. If you are giving more than that, the child might spit out the excessive milk. Along with that, you need to properly check into the weight gain. If the weight gain is adequate, then we are probably giving the good amount of formula milk. But preparing formula milk, taking caution in sterilizing the bottles is very important. Now, it also depends upon the weight the child is having, that how much is required. So roughly, if in initial few, if the child is suppose I say the child is 3 kgs, so that child might require around 40 ml of milk every 2 hourly. But depends upon the age also, and it depends upon the weight also, the how much the formula is required. But as a mother, you might be able to tell this better as you see the child taking feed every time. But every time when the child cries, it's not necessary to give bottle feed and formula feed which you are giving. Look into the causes, that if the child is crying for some other reason, so if that time the child takes excessive milk, he might be spitting out the milk.
Right, Dr. Manoj. Doctor, for formula fed babies, bottle fed babies, in fact, uh, does the shape of the bottle or the teat of the bottle have any impact on the amount of air that the baby ingests and reflux issues as well?
Yes, it can happen. Many varieties are available in market. So we usually advise that those, sometimes the bottle are like, they have pores in that. So those pore bottles, will be, there is dripping of milk from those pores every time. So even if the child is not sucking, there is dripping of milk. Also, the teats of bottle are like round shape and all those things. Sometimes they are elongated and sideways there the teat is there. So I think if even the sizes are available, so you just check if when you are giving bottle milk, the if the child is making excessive sounds while taking milk from the bottle, or if the child, sometimes even just this can help you, that if the child is excessively spitting out milk, you just try and make changes in your bottle and teat so that it just fits the child's mouth. So it will help in preventing excessive engulfment of the air. But I won't comment on the bottle part much, because this is commercial things. But I'll advise you just take into account all those things, that the teat part, the the product which these bottle are made of, especially if they are free from BPA and all those things. All these will help you in preventing this, not just the reflux, but also all these plastic things and microplastic which we are engulfing nowadays.
Right, Dr. Yadav. Uh, Doctor, when it comes to the road ahead for babies who are dealing with issues of spit up and reflux, does infant reflux resolve on its own? Does it go away on its own, or are there things that parents need to do to deal with this in the long term?
So I think in most of the cases, around 80 to 90% of the cases, reflux goes on by itself by 1 year of age, and in almost all the babies by 2 year of age, unless and until there is some underlying conditions. If there is laxity of lower esophageal sphincter, or there is hernia at the site of lower esophageal sphincter, or there are some surgical conditions associated with the kid, or sometimes there is chronic esophagitis, or there is infection which is causing chronic esophagitis, or there are some H pylori infections in some kids. So these might be causing non-dissolving reflux, esophagitis, and reflux. Otherwise, most of the reflux goes on by 1 to 2 years of age. Also, in some food allergies, the reflux could continue for a longer time. So even if you still think that your child is having reflux and spitting out milk, which you think is not normal, I think there is no shame in going to a doctor and asking if it's correct or if the child is having any issues. Or instead of just discussing amongst yourself if the child this can happen with you or not, sometimes every child is a different, and he might be facing a different condition rather than the earlier child or the neighbor's child. So I think it's better to consult.
Right, Dr. Manoj. For those of you who have joined us in between, I encourage you to watch the entire video on Parentune to understand why your baby spits up milk, the causes behind reflux, and how to deal with that as a parent. I would also like to remind you that you can ask your questions to Parentune experts and doctors 24/7 on the Parentune app. Also, remember to subscribe to our social handles for reminders on our interesting lives and workshops. Dr. Manoj, before we conclude, if you could tell us what are the top three things that you as a parent should remember to do if your baby is spitting up milk frequently?
I think the first and the foremost, try and breastfeed your baby instead of formula milk. The second thing, burp your baby every time, even if it does not burp properly, but at least burp for 5 to 10 minutes. Third thing, try and do this prone position and tummy time. It will help you a lot. Fourth thing, in case the child is having good weight gain, do not worry. If there is excessive reflux and still you are facing weight gain, excessive irritability issue, then you can consult a doctor. For the fifth thing, that in case there is some surgical condition, or then you go to regular visit with your doctor and check if it's anything is more is needed instead of reflux. Then sixth thing, if the child reflux does not subside by does not decrease by 5 to 6 months, or it goes on up to 1 year, then you could go to a doctor, take medications. In case the doctor advises you for some procedures, also some diagnostic investigations like manometry, upper GI endoscopies and all those things, do not worry, this will probably help you in good weight gain of the child. Fifth thing, that just try and give more of calorie dense diet in complementary feeding and in later part also, because that helps in preventing excessive distension of abdomen and the reflux part also.
Right. Thank you so much, doctor, for all those tips and advice on how to deal with baby spit up, the causes behind reflux, and how you as a parent can help your baby. Um, we will be back tomorrow with another Parent Tune Live with pediatrician Dr. Rakesh Tiwari, जो हमें बताएंगे कि सर्दी के मौसम में बच्चे के स्वास्थ्य के को लेकर हमें क्या सावधानियां बरतनी चाहिए. Thank you all for joining us today. Take good care and see you on the next Parenting Live.
Thank you.
Thank you, Doctor.